Welcome to the first team brief for 2021. I'm optimistic about this year, and we can, by the spring, start looking at getting back to normal. It will take some time, and everything won't happen all at once, but I do believe that with a fair wind in our sails, we'll be in a much better position, and life will start feeling that little bit more normal. On that note, I wanted to kick off this month's team brief with a quick update on how COVID-19 vaccination programme is coming along. Our COVID-19 vaccination programme got off to a fantastic start at the end of December and has continued at pace as we work through the list of priority groups. The mobilisation, organisation and delivery of the vaccine so far has been a great sense of pride for all of us, and we are making a significant contribution to beating the virus as we begin returning people's lives back to normal. We have vaccinated over 3,800 members of staff so far, and we hope to have vaccinated all remaining colleagues very shortly. If you haven't yet booked your vaccine, please do so. Don't pass up on this really important opportunity. I'm sure you will agree that the efforts made across Tameside and Glossop so far by the Clear Cognition Group and the Trust have seen us progress at a faster rate through our priority groups than many other areas. I'm told that we have now vaccinated over 90% of our over 80 population, which is fantastic news. The response by the public and the staff has been fantastic, with many people delighted at the opportunity to receive the vaccine. That just shows how important it is for people to get protected and start getting back to normal. You will be aware that from early November 2020, the Trust began participating in the rollout of NHS 111 First. The new service is aimed at reducing the demand on our A&E department by encouraging members of the public to contact NHS 111 in the first instance, instead of going straight to A&E, except in emergency and life-threatening cases. Another addition to our emergency department offer is e-triage. E-triage is a new service we offer in ED, as pictured here, which asks patients a number of questions upon arrival. This intelligent system then triages the patient to the best care for their condition. This could be remaining in ED, redirecting to the urgent care treatment centre, or another service. The e-triage service is allowing us to better utilise nursing staff who would have previously provided a secondary triage in different areas of the department. So this new service definitely helps us save time where this is needed. The e-triage iPads are operational 24/7, and we have volunteers in the waiting room each day who are helping patients should they need assistance in completing the triage on the iPads. The reception team are also directing patients to the iPads to ensure e-triage is completed. Some of you might have seen the great news article recently about our urology team. Using a new technique, the team are able to diagnose potential prostate cancer cases quickly by using a new process which reduces the risk of post-procedure infection. The new service, called the Prostate Best Time Pathway, means that patients can now get diagnosed quicker because we offer patients local anaesthetic, transperineal biopsies in the outpatient department. This is a significant improvement for patients who previously had to be admitted to Stockport NHS Foundation Trust and have a biopsy under general anaesthetic, or who had to face a significant wait to have their procedure carried out in the surgical day case unit. Most patients referred into this service on a prostate cancer pathway by their GP will be invited for a scan straight away. The results will then be reviewed by the urology team, and those patients that need it will be invited in for a biopsy as an outpatient. I also wanted to tell you about the great work that our district nurses are doing. Our district nurses in Denton, Audenshaw and Droylsden have recently been surprising their patients with afternoon tea to cheer them up. Many of the patients live alone and due to COVID-19 restrictions have become quite isolated. For many young and old, the pandemic has posed more than just the risk of contracting the virus, but also the consequences of not being able to see family and friends or go to the places you would normally visit. This takes its toll on a person's mental health and well-being, and any gesture such as this goes a long way in making somebody feel better and connected. The afternoon teas are kindly donated by Peggy's Kitchen on Greenside Lane, Droylsden, and I'm really proud of the care the District Nurse Service have provided during such a difficult time, whilst undertaking such a thoughtful act, dropping off afternoon teas for our most vulnerable in our community. As we manage a third wave of COVID-19 infections, it's really important to maintain high levels of infection prevention. Recently, we have seen some masks being worn incorrectly, and we ask colleagues to adhere to the basic standards of infection prevention and to the National Campaign for Everybody's Protection. Face masks must be worn appropriately to reduce the risk from respiratory secretions. See the diagram on screen now for what you should and should not do with your mask. Let's all challenge our colleagues to keep ourselves safe if PPE is not worn correctly. Finally, it's been difficult over the last 12 months to continue the momentum of the Trust Scanner appeal. What with the significant reductions on gatherings and very few opportunities to raise funds, it's been really hard. All that said, we now have over £130,000 in the bank for the appeal, and that is down to the continued efforts of everybody involved, despite the restrictions. I wanted to thank you for all your contributions to date and encourage you to think of creative ways to raise funds in the way we have done to date. We can do this if we all continue to pull together.